Welcome back, everyone. Kristin is with us today. She's a certified nurse practitioner with Lima Memorial. We're talking a little bit about lung cancer because November is Lung Cancer Awareness Month. Let's talk, first of all, I guess, how prevalent it is in the country and also locally here at close to home. How prevalent is it here in our area?
Lung cancer is actually really prevalent here in Lima. We're seeing it in a lot younger population. Typically, you think of the older population, someone that's been smoking for a long time, that is getting lung cancer. Lung cancer is actually the #1 killing cancer in the United States. And so it's really important for us to get the word out there to get people screened because, I mean, we live in an area where, you know, it's not only smoking, there's refinery, there's foundries. People are exposed to all sorts of different inhaled toxins here in Lima.
You know, the other thing, I know you guys talk a lot about this, and you just mentioned it, that idea of staging and getting it early. Talk a little bit, if you could, how important that is to try to catch this early on.
So lung cancer itself, when it becomes symptomatic, is usually a later stage. So for us, finding it early usually leads to a cure rather than just treatment. And it actually increases your 5-year survival rate as well. And that's something that's very important to us when we talk about lung cancer, is that the earlier you can catch it, the better off your 5-year survival rate really is.
It's amazing to me, even the last 5-10 years, to see the technology that you guys have to try to catch it, as you said, at an early stage, and we get better pictures of what's going on. Talk about that technology and how that's changed and how important that is.
So what we offer here at Lima Memorial is called a low-dose CAT scan, meaning that it uses less radiation than a typical CAT scan. And what it does is we look to see, are there any new nodules in the lung? Are there any enlarged lymph nodes? Is there anything suspicious that would be early cancer? If we do find a nodule, we do repeat CAT scans depending on the size to determine, you know, is this something that we need to watch? Is it something that needs biopsy? Because usually you don't know that you have nodules in your lung. Usually that's something that comes about, you know, that we catch on a CAT scan that is an incidental finding. And so for us here at Lima Memorial, we have that technology for the low-dose CAT scans that we can offer patients.
Yeah, it amazes me to watch you guys when you're looking at the scans and what you're looking at, how you're able to find something that stands out, a darker shade, that kind of thing. How has that technology made that process a little easier for you guys, giving you a more vivid image?
It has, yep. And so we're able to see everything in the lungs, the lymph nodes. We even have a technology here at Lima Memorial where it will send those CAT scans over to a software, and that software is able to measure it and then track all of these nodules for us. And so it's an additional software that we have here at Lima Memorial to help track these people. And as soon as you have a nodule or a spot or an abnormal CAT scan, we're trying to get you in the office the very next week to talk about it.
You mentioned that low-dose CT scanning. For those who are watching and think, well, maybe I'm a candidate for that, especially if they've had some of those factors in their lives that you had mentioned earlier on, if they think that maybe that's the next step for them, what do they need to do?
So what they need to do is they need to get a hold of their primary care provider. If they don't have one, Lima Memorial offers some great professional corporation primary care providers that can get them ordered. If you are between the ages of 50 and 80, and you have a 20-pack year history, meaning that you've either smoked 1 pack for 20 years, 2 packs for 10 years, half a pack for 40 years, you know, and you are either a current smoker or have stopped in the last 15 years, you're definitely a candidate. And I think it's very important for everyone to take that initiative to ask their primary care provider, am I a candidate for this? And if so, can you please get it ordered for me?
Yep. Help is available. Good information. Kristin, thank you so much. We appreciate it.
Thank you.
You bet. Nice chatting with you. We'll be back right after this.